In September of 2000, the city of New York hosted the Millennium Summit, attended by delegates of over 180 countries. The proposed Millennium Declaration signed by the representatives was a tool to ensure each country achieves a specific set of goals that focus on improving the lives of underprivileged populations by year 2015. The goals include eradicating extreme hunger and poverty, achieving universal primary education, promoting gender equality and empowering women, reducing child mortality, improving maternal health, combating HIV/AIDS, malaria, and other diseases, ensuring environmental sustainability, and developing a global partnership for development. The issue of extreme hunger and poverty still remains a ubiquitous problem, as Syria has yet to make any sufficient progress reducing the issue. Despite making some advancement in the urban areas of the country, where extreme poverty rates were seen to drop between the years 1996 and 1997, and again in 2006 to 2007 from 12.6% to 9.9%. There is still significant improvement to be made, especially in the rural and suburban southern region of the country. The issue of excessive droughts and the succession of rural-urban immigration from the northeastern rural region to the south urban region have impelled the issue of extreme poverty to an even greater extent. In juxtapose, Syria has seen optimistic improvement in the poverty gap ratio, which determines the depth and spread of poverty below the poverty line, as rates fell from 2.88% to 1.97% in 2007. These numbers surpassed Syria's target of 2.1% for that year. In accordance with this, Syria seems to be making improvements in the distribution of household consumption expenditure in the country's poorest quintile, which makes up 20% of the population, as numbers rose from 7.91% in 1997 to 8.17% in 2007. The improvements to household expenditure in the country's poorest 20% are reflected in part by the rapid decline in the share of the population falling below the food poverty line, falling from 3.6% in 1996 to 1.2% in 2007. Collectively, these figures indicate the notable improvements Syria has made and will continue making to improve the lives of those facing extreme poverty in the country.
In terms of improving their current system, Syria has failed in their efforts to deliver quality education to students throughout the country. Although the net enrollment ratio in primary education for children ages 6 to 11 has increased from 95.4% in 1990 to 99% in 2008, Syria has yet to promote the importance of quality education. Syria has made some progress in creating a climate conducive to feminism, as gender disparities in all levels of education, primary, secondary, and university, have been reduced. Both primary and secondary levels of education were merged into basic education as of 2009, which led to an increase in the ratio of girls to boys in academic institutions. Despite these improvements, the country saw a drop in vocational education, falling from 70% in 1996 to 66% in 2008. These figures illustrate the fact that improvement to education rates have yet to influence women's status in economic and political sectors. The proportion of women holding leadership positions in the government still falls below 20%. However, findings show that the percentage of women in wage employment in the service sector rose from 21% in 1991 to 29% in 2007. Major feats have also been made for women in parliament, as their involvement has increased from 2% in 1971 to a staggering 12.4% following the 9th legislative term in 2007.
Ensuring the health and growth of children in Syria is considered one of the greatest national priorities, and as a result, has made great victories in reducing the rates of child mortality in the country, figures first ever to appear in the 2010 Millennium Development Goal Report. In fact, the under 5 mortality rate dropped significantly from 41.7 for every 1,000 live births in 1993 to 18.9 in 2008. A major contributing factor has been the implementation and commitment of the National Immunization Program, which has been an effective method in decreasing the occurrence of pediatric diseases. Prompting these achievements is the increase in the number of children receiving their whole immunization schedule, as well as the proportion of coverage for infants against measles, which rose from 83.5% in 1993 to 92.4% in 2006. Syria has achieved substantial progress over the course of the past 15 years by improving the health of women in their reproductive years, those constituting over half of the female population in the country. Maternal mortality rates fell countrywide from 107 deaths for each 100,000 live births in 1993 to only 56 in 2008. Notwithstanding these successes, Syria needs to maintain their focus on a subnational level, especially in vulnerable areas with low economic and educational levels, including the eastern region and rural parts of the country. Furthermore, antenatal coverage is considered a major priority in the field of reproductive health, which involves educating pregnant women about all things related to pregnancy and breastfeeding, as well as regular checkups. Developed in 1993, antenatal care, in accordance with the rate of coverage, has risen from 50.3% in the initial stages to 84% in 2006. While urban areas are progressing onwards, rural parts of the country are facing difficulty as a result of increased demand, lack of education and support, financial struggles, and poor access to transportation. All areas that need to be vigorously tackled if Syria wants to achieve this goal.
With respect to the issue around HIV/AIDS, the main concern is for people ranging from ages 15 to 24 who are most at risk for contracting STDs. Findings from a quantitative study in 2008 show that more than 75% of youth were aware of and had knowledge about AIDS. However, the level of knowledge was found to be higher in urban areas than rural areas due to the lack of media coverage and campaigns in those parts of the country. In regards to achieving universal access to treatment of HIV and AIDS, Syria, being a low HIV/AIDS prevalent country, should be able to reach this goal. The country has done its part eradicating issues around malaria, however, the focus now needs to be centered on tuberculosis, as the number of deaths has increased from 86 in 2002 to 111 in 2007. The Syrian landscape has undergone excessive deforestation, especially in the second half of the 20th century, which decreased the amount of land covered by forest. Syria has set a target to increase land area of forests to 3.86% in 2015, from 3% in 2007. High levels of carbon emission are a problem that needs to be addressed by the country, as emissions have soared 25 million tons in 1990 to 59 million tons in 2005. Measures need to be taken in regards to efficient water use in agriculture, as the Syrian irrigation network is using 89% of groundwater for agriculture use. As of 2008, the water deficit in the country stood at 2.4 billion cubic meters. Drinking water in Syria has gained honor as the percentage of the population using systems of improved drinking water rose from 65.6% in 1990 to 85% in 2000 and again to 92% in 2007. The amount of people benefiting from improved sanitation also rose from 55% in 1990 to 82.4% in 2009. There is still an urban-rural disparity that must be addressed. However, Syria is maintaining their efforts to improve the rural figures. Another major problem preventing the success of eradicating extreme poverty is the lack of environmental management. Climate change resulting from degradation and deforestation of a country's ecosystem plays a huge role in the poverty dynamic. As is the case for most of the Arab region, Syria's water resources are being expelled at a much faster rate than nature can replenish them, consequentially impacting both social and economic levels of the country. The result of excessive drought and land degradation makes agricultural production difficult, thus affecting the income levels of many families whose income relies heavily on agricultural commodities. Things such as livestock, wheat, olive oil, and fruits and vegetables contribute to nearly 25% of Syria's GDP. In 2008, Syria suffered from a terrible drought that propelled a job loss exceeding 1 million in the agricultural sector. Small farmers suffered from major losses to their herds, while some 47,000 farmers owning larger amounts of land lost over half of their livestock. Greater focus needs to be placed on addressing the impact of environmental damage, as well as reducing the amount of CO2 carbon emissions in the atmosphere and improve on disaster risk management.
In terms of development assistance, Syria makes up the region receiving the least amount of official development assistance, receiving only about 90 cents per capita. While 90% of this went towards social infrastructure, less than 10% was directed towards the economic sector. Furthermore, problems of political consideration caused the level of official development assistance to fall from 92.3% in 2005 to 84.6% in 2007. Syria is currently employing reforms to create a regulatory environment for the application of the economic approach of a social market. They are also working towards a balanced foreign trade policy and mobilizing efforts for access to the World Trade Organization. Syria has achieved success in handling its foreign debts, as the country has managed to reduce the debt service to export ratio to 5.2% in 2007 from 22% in 1990. figures that have allowed Syria the opportunity to finance the Millennium Development Goals.